Health insurance in Germany is not optional. It is not something you think about later. It is the foundation, the very first thing the system asks for. And if you get it wrong, or if you leave it to change, the consequences follow you for years. But here is the thing, once you understand how it works, it is actually one of the best systems in the world. Geniusly, I say this as a German and as someone who has helped hundreds of expats navigate it. My name is Martin, my customers call me Mr. Martin, and I am an expert for expats in Germany. Today I want to give you a complete, honest picture of German health insurance before day one. Every week I speak to Indian professionals who are preparing to move to Germany. They have great jobs, they have done everything right, and still they arrive with questions about health insurance that were never answered, not by their employer, not by the consultant, not by any website they could find in English. So I made this video to answer those questions properly. We are going to cover what type of insurance you will have, how much it will cost, what it actually covers, and what you need to do right now before you arrive. Let us go through this together. Germany has two completely separate health insurance systems, and which one you land in changes everything. System 1, gesetzliche Krankenversicherung in Germany, that means statutory health insurance, what most people call public health insurance or GKV. System 2, private health insurance, private Krankenversicherung or PKV. Private health insurance works more like traditional insurance. Premiums are based on your personal risk profile, your age, your health history, and the coverage level you choose at the end. Now, if you are arriving in Germany on an employment contract and your salary is below the compulsory insurance threshold, you are automatically required to join the public system. You do not have a choice. This is compulsory. Okay, if you earn above that threshold, you have a choice. You can stay in public insurance voluntary, or you can opt for private insurance. Most Indian IT professionals I work with start in the public system. Some who are on senior contracts or who are negotiate higher salaries early may qualify for private insurance. But this decision is significant and it is not easily reversible. No, let me tell you what public health insurance in Germany actually covers, because I think it will surprise you. Doctor visits covered, specialist consultations covered, hospital stay covered, emergency care covered, mental health treatment covered, maternity care fully covered, preventive screening covered. And if you are enrolled in the public insurance, remember this, your spouse and children who do have their own income are covered at no additional costs. No separate premium for your family. This is geniusly remarkable. Dental care is a partial story. Basic dental treatment is covered, but things like dental implants or high-quality crowns usually require either a top-up policy or privacy payment. And vision care, glasses and contact lenses are generally not covered for adults. But the core coverage is comprehensive. If you get seriously ill in Germany, you will be taken care of. That is not something you can say about every country in this world. No, let us talk about costs, because this is what everyone wants to know. In the public system, your premium is calculated as a percentage of your gross salary. The total contribution rate is 40.6% of your gross salary. This is split equally between you and your employer. You pay one half, you your employer pays the other half. There is also a maximum contribution ceiling. You do not pay this percentage forever without a limit. Let me give you a simple example. So, say you earn 5,000 euros gross a month, you pay usually 400 euros a month from your side. Your employer pays usually the same a month, and your family is covered for free. For most people, that is very reasonable price for comprehensive healthcare. Now, this brings us to another question. It gets constantly, which public health insurer should you choose, and does it actually matters? And honest answer is yes, it matters, but maybe not in the way you expect. The basic benefit packages is identical across all the Krankenkasse. Every public insurer in Germany must, by law, provide the same core services. Where they differ is customer services, additional benefits, and critically English support. For Indian expats, that last point matters enormously during your first year in Germany. If you have a problem, a question, or a claim to make, you need to be able to speak to someone clearly. I consistently recommend Krankenkassen that have English-speaking support teams or digital portals in English. It makes your life much easier. Some names worth looking into are TK, Techniker Krankenkasse, which is very popular with expats and has excellent English support. BARMER is another strong option. Also ask your employer which Krankenkasses they usually work with. Many companies have private insurance they process paperwork through, and working with that insurer can make your enrollment much faster. So let me give you a pre-arrival action plan. 3 things before you arrive. First, confirm with your employer which Krankenkasse you will be enrolled in and exactly when your coverage starts. Get the date in writing. Second, if there is any gap, even on or 2 days, arrange short-term international expat health insurance to bridge it. Number third, gather your documents, passport, enrollment contract, German address, and if your family is coming with you, have their documents ready too. That is it. 3 simple steps. None of them very complicated, all of them important. Let me quickly bring everything together. German's health insurance system has 2 tracks, public and private. Most of you will be in the public insurance. Your contribution is shared with your employer. Your family is covered for free, and the coverage is geniusly excellent. Choose your Krankenkasses thoughtfully, confirm your coverage start date, bridge any insurance gap, prepare your documents. And if you want to talk through your specific situation, your salary, your family, your employer, or your city, I am here. If this video helps you, please subscribe. I make 1 video a week for Indian expats at every stage of the German journey. And when you are ready to get your health insurance sorted, probably sorted with someone who actually understands your situation, visit NeoDirect and book a free consultation. No pressure, no sales pitch. I have helped hundreds of people from India make this transition. You are not alone in this, and you are not have to figure it out by yourself. I'm Martin. See you in the next video and take care.